This episode is brought to you by the folks over at the Colorado Surgical Institute. Did you know that on average, a general dentist refers 20 to 30% of their cases to specialists? One of the goals of the Colorado Surgical Institute is to help GPs keep as many of those cases within the four walls of their practice as possible. Not only will keeping more advanced procedures in your practice improve your bottom line, but more importantly, it will help to create an improved patient experience. CSI is a completely hands-on training facility where attendees learn in a safe and controlled mentor-mentee setting on live pre-screened patients. How would your practice and career change if you could perform sinus lifts, block grafts, implants, and full arches in your own practice? And if surgery is not your game, give them a call to find out more about the new hands-on IV sedation course starting this summer. CSI's quality control and standards are second to none. All patients move from the screening phase to the planning phase to the surgical phase and to the restorative phase, all under the care of the doctors and team over at CSI. On a personal note, before I sold my practices, the CSI crew came out and trained my team and changed how I view referrals and high-profit procedures. I can't say enough about the quality of education and support I've gotten from the good folks over at the Colorado Surgical Institute. The next courses are the Full Arch course on August 3rd through the 6th. September 7th through the 10th is a single implant and wisdom tooth course, and the IV sedation course begins June 15th. For more information and to register for the next course, just go to coloradosurgicalinstitute.com or give Director Chris Richards a call at 970-420-6148. coloradosurgicalinstitute.com.
The Dentalpreneur Podcast. Okay, doctor, it's time to put down that handpiece. You're listening to the show dedicated to helping dentists get their lives back. It's time to decrease your stress, increase your profitability, and regain your passion. Now introducing your host, Dr. Mark Costas.
Hello, everyone. Welcome to another episode of the Dentalpreneur Podcast. I'm your host, Dr. Mark Costas. What's up, friends? I hope you're doing great out there today. Hey, this is Surgical Saturdays, and I'm here with the two biggest surgical studs that I know. They're not big, but they are excellent surgical studs. Not physically big, but as far as their skill set, very big. We have Dr. Dan Briskie with us today, as well as Dr. Taher Dhoon, who is walking around and making me dizzy as he walks around his new office, his new gigantic office, and bumping around like the Blair Witch Project. So anyway, guys, how are we today? I had a
really cool, doing really good. So I was at the park with my kids the other day, and they had this like really cool zip line. And this hallway that I just walked through is so long. I was like, what if I put backing in the ceiling and ran a zip line from one side of the office to the other? And I presented it at the team meeting, and they thought I was nuts. So we're not doing that.
Okay. Well, anyway, maybe a one wheel or something similar would be appropriate.
Mark, I love how you shamelessly plugged your biceps size during the big podcast here. What Mark meant to say was his biceps are definitely bigger than me and Dhoon's.
Yeah.
No, I didn't mean to say that at all, but okay, I'll take it. All right. I'll take my lumps. Gentlemen, today, interesting topic. We're going to talk about PRF, and if we have time, we'll get into membranes as well. I do have to say that you guys really turned me on to PRF. I did a lot of my PRF training through you guys, through Colorado Surgical, just being around the people that had used that as a large part of their armamentarium, and being able to see some of the post-ops and some of the end results of utilizing PRF and how effectively it works in the healing process. It's actually a miracle. It's unbelievable. I can't believe that it's not more mainstream yet in medicine and in dentistry, but those people that have used it and seen the miracle effects of it are zealots for sure. So I'll start with you, Dan. Tell me about the benefits of PRF. And I don't know exactly the direction you want to go with this, if we're going to get technical, or if you want to just talk a little bit about how you utilize it and when it's necessary.
So I'm going to talk about two things specifically. The benefit is definitely the growth factors is the one advantage. The negative is the timing, in terms of how, the doctor may be having to learn how to do venipuncture themselves, and integrating into the practice. So we all know that the benefits are fantastic with the amount of growth factors that are released by tucking a PRF membrane underneath the tissue and having bone grafts and wisdom teeth and implants just become much more successful. I think the part where people miss it is that they have to do it, right? They have to learn the venipuncture. And for some reason, that for some people, that's a barrier. So I definitely caution everyone to get comfortable, poking people, taking some blood out. It is awesome because you can charge for it. I think the code's 4265, biologics. I think there's another code now as well, I think from insurance. Dhoon, you can correct me if I'm wrong. I think there's a new code for it now. But we're commonly charging either $200 a case or, $50 a site, something along those lines. So I think the cost per application is around $7 to $10 to do it each round that you do this too.
Yeah, for sure. And how do you get reps? I mean, do you think it's necessary to take like a course, or is it something where you can just line up a bunch of your dental assistants and poke them all and get your reps that way? Or I know that our license covers it, but what's the best way to get reps quickly?
Dhoon and myself like to practice on staff members.
Of all shapes and sizes.
Yep.
Yeah. So years ago, I actually went to a course, and, I took my 2 lead DAs at the time, and it didn't really move the needle. There's only so much you can talk about the anatomy in an arm and, a way to do venipuncture properly. And then after that, it's repetition, really. So for anyone listening, it's just like, hey, look at your state requirements, contact your malpractice. If you really want to do your due diligence, make sure you have that all lined up. But once you do, typically speaking, it's just reps. Like I would even practice on myself, and so I brought a centrifuge home. This is like, 9 years ago now, but centrifuge home, brought all the stuff home, practiced on myself, looked like I had a couple of track marks as I was practicing, but you get really good at it. And then family members, and then obviously staff. And then if you guys have team driven approaches, I would train your team on this stuff too. Like I can come into the room, the blood draw is already done for me. And it makes life easier as well. So once you get used to the anatomy in the arm and you got the usual places you like to go, it's actually pretty straightforward to get comfortable with veins and vasculature and figuring out exactly where to get the stick done.
You can take a local phlebotomy class if you want to. They're pretty cheap, a couple $100 if you really want to get a rep in. I know a lot of hospitals have phlebotomy courses are like $300 maybe. So maybe a couple practice rounds there if you really want to learn. Other than that, there's lots of free knowledge out there. You have patients who are phlebotomists, and you have patients who are EMS, and you have patients who are paramedics. And so you could just pay the guy like, hey, I'll have you come in for $300 for the day and just line up a bunch of patients that day, and then have that person come in and just hold your hand and your team's hand through the entire process and practice on each other. And that's just a very, grassroots way or, economic way of kind of getting that implemented into your practice too. And, incorporating a patient as well.
Got it. Awesome. So that's the biggest kind of hurdle and recognition that must happen, is that you have to be able to find a vein and draw blood. So let's talk about some of the benefits and when you guys actually utilize this as far as a technique to enhance and speed healing. Start with you, Dr. Dhoon, since you're ready to go. You look like you're about to say something.
Oh yeah. So first and foremost, make sure at the consult when you're treatment planning them, or if you're in the operatory, look at their arms, look at their hands, evaluate them. Just make sure they look like you can get the stick. Because in the beginning, for me, when I was missing the vein at the very beginning of the surgery, I'd miss the vein. It kind of like messed with my confidence a little bit. And so just know, like, hey, if they're a tough stick, I ask everyone, like, hey, if you give blood, are you easy or are you difficult? And then the patients who know they're difficult, they're like, oh man, like I'm crazy hard. Don't worry. You can try it 4 or 5 times. It's okay. And they kind of give you permission ahead of time to search. And other patients say, hey, like, look, I'm difficult. I faint. And maybe that patient, you don't treatment plan the PRF on in that scenario, because sometimes, it's not always worth going after it and using the patient as a pain cushion in the beginning. But let's say 85% of patients, you can get the vein on. Everything is good to go. Then from that perspective, I'll just tie the tourniquet, draw the blood. And then I like using it for wisdom teeth. So for me, I charge $110 a site. I only charge them for 2 sites because I only use it in the lowers. And so for wisdom teeth, I'll draw 6 tubes and I'll put 3 slugs in each socket, maybe 1 chromic over the top, chromic gut suture over the top. Sometimes you don't even have to suture them if the tissue is approximating really, really well. I'll use it inside the sinus for vertical sinus lifts. Sometimes you don't even have to use bone graft material in there. That's the coolest part for me. It's you lift the membrane with PRF and then you come back in and you take your post-operative x-ray, a year later or so. And there's just bone formation in there. It's amazing. And then you can cut it up and mix it up with your bone graft and make sticky bone. If you get, Briskie, is it the blue tube that you have to get also? Or is it the white tube?
I don't know.
Editor.
Editor for sure. That's a very specific question.
Here,
My bad.
Okay, well, I'll bring us back in. So
yes.
Okay, so when you actually let's talk just a little bit about the technique. So the cool thing is once you get your dental assistants on board, once you actually make the stick, and if they're trained, they can make the stick as well and draw the actual blood. But once the team is all on board and the vials are drawn, they can take it from there. They can create all of the PRF. It's actually not that technical once the blood is in there. We're going to centrifuge that blood in the tubes, and then they're going to pull out and separate the good stuff from the unusable stuff, and then they're going to press it, and you're going to get a bunch of slugs. So I don't want to oversimplify it, but at the same time, I was just wanting somebody to kind of talk through exactly what that process looks like and what the end result looks like, what the PRF material actually looks like when we're putting it into a socket or using it, chopping up and putting it in sticky bone, et cetera.
So when you grab the blood, right, it's going to start immediately clotting. So you have to immediately put it in the centrifuge, and the times are going to vary based on the protocol, really just for what centrifuge you currently own. So the one that I own might be a little bit different than the one Dhoon owns. Versus what they, maybe a $2,000 one that some implant company wants you to buy. So Dhoon and I are going to always recommend something very economical. I think my centrifuge costs like $300. So pretty economical. And, if it breaks, you could use it for 2-3 years. It breaks, you throw it away and buy a new one. Right. That's the best part about it. And for ours, you usually do an even numbered one because the centrifuge, the little bottles have to line up to each other because they spin. So I'll usually do like 2 is the minimum number. If I do 1, I'll put a vial full of water to balance the machine out, and then you spin it. The spin stage for ours, I think, is 17. It can be anywhere between 13 and 17 minutes at 2,300 RPMs is what it is. And then once it's taken out, it's a clear kind of foggy yellowish liquid on the top, and then you see blood on the bottom. And then if you stick a cotton plier inside of it, you can pull up, and it looks like this yellow booger connected to a red booger, right? Very scientific. So your goal is to take that yellow booger that's connected to the red booger, and you take scissors and you literally just cut the red booger off. So now that you have the red portion is still in the vial, you take the yellow portion out and you put it in a PRF box. The PRF box you can get from anywhere. I think I bought mine from eBay. I think it costs $24. So very economical as well. You can use it over and over and over and over for, 5-10 years with the same box. Mm-hmm. So after you put it in the box, there's this little metal sleeve that goes on top of the PRF itself. It compresses it. to the exact weight that you want it to. So you can actually just let it compress itself. So I'll usually do this ahead of time before I take the tooth out or before we do the bone graft. And it'll be condensing while you are doing the procedure itself. So after it condenses, you just lift up the metal tray, and on top of it, that booger, which was maybe like a 1/2 inch wide and like 2 inches tall, is now very thin. It's about 3 millimeters in width, and it's still about 2 inches in length.
Yeah, so it looks a little bit like a membrane at this point. It's a yellow looking moist membrane is basically what it looks like.
Yes. Yep. Very much so.
Okay, I'm editing this out.
Are we writing this down for a quick little edit?
Yeah. I'm just writing it down.
Sorry, I should have jumped in.
Yeah. No. Okay.
Can I go to a couple things?
So, yeah, go ahead and start wherever you want, Briskie, and then hand it over to Dhoon. This is still edited out, so go ahead and start fresh whenever you want.
So there's a few things that I want to point out when using a PRF membrane. A couple of common misconceptions that I see a lot of the time posted on the internet. One of them being is there's this article by Picos and a few other docs, and it discusses the use of PRF as a barrier membrane, whether or not it can be used alone or in addition to a collagen membrane. So I see a lot of people will just put PRF over their socket preservation, and they'll still get a little bit of bone loss on the crestal portion of the graft. So PRF, even back in the day, Mish called it a quasi membrane. Picos also agrees that it's not really meant to be used alone. It will resorb growth factors, but you're going to want to use it in combination with something. The only time you're not going to use it in combination with something is if you're not going to re-enter the site. So PRF alone is a really good membrane used by itself if you're not going to re-enter the site. So for example, like a lateral sinus, right? You could put it on the outside of a lateral sinus wall, and because you're not going to go back in, you can use it alone. You actually don't need a collagen membrane, as opposed to a site maybe where you did a big GBR and you're going to be augmenting the ridge to get the bone more horizontal. You're going to be re-entering that site. So in that circumstance, you're going to be using a collagen membrane and you're going to be using PRF. So you're going to do collagen membrane first, and then the PRF is going to be laid on top of the collagen membrane, and then you close the tissue up. So I always like to point that out. I try to use things based on research and what they're not meant to be. I've used it alone in socket preservation, and I'm getting mixed results. I don't like mixed results, so I'm going to usually follow the book here.
Gotcha.
Yeah,
Dr.
and when
Dhoon,
I do regular socket preservation.
Go ahead.
Yeah, and when I do regular socket preservation, I put the PRF down. Like, so for example, this morning, we do the draw. And actually, one thing to point out about this guy this morning is I did the alcohol swab on his arm, and we got a bunch of dirt right off the vein. So make sure you use alcohol swab on everyone just to make sure you're not introducing anything into the vasculature. But then by the time I'm done extracting the tooth, prepping the site, cleaning out the infection, the PRF is spun, and then I put the bone graft in. When you compress your slugs at the bottom of the dish of the PRF tray, there's like the fluid that collects because it's compressed the PRF slug into something flat like a membrane, and then all the fluid from that collects at the bottom of the dish. I use that to hydrate my bone graft, and then I'll bone graft the site, put 2 or 3 layers of my PRF slugs down, and then I'll cover it with a Cytoplast TXT 200 membrane I get from Osteogenics. You can get any Cytoplast membrane. It's like the DPTFE stuff, but you can just cover that up, and then I suture over the top. So from that perspective, I agree with Dr. Briskie. I don't use PRF just to cover anything by itself, unless, like he said, you're not re-entering the site. So in a complete agreement on that.
Yeah. What are the benefits? We'll close this up by, all right, we kind of went through the technical aspect of things, how you guys are utilizing it. What are the benefits of utilizing PRF, and why should anybody go through all the trouble?
Biggest one is closing the wound faster. So it increases the speed to which the defect closes. It also increases the regeneration and healing due to the amount of growth factors that are released. Then also, most importantly, aids in defense. So I love it over my implants because it's going to, it actually will release, leukocytes, which actually significantly reduce the amount of infection and complications around like an implant or a bone graft. So I feel like my implants success rates have gone up a few percent just by adding PRF in the mixture for implants.
Yeah, 100% agree with Dr. Briskie. So you just remember back in school, right? Epithelial growth factors, tissue growth factors, all that stuff that sits within the red blood cells and the platelets. When you spin this stuff down, that's what's separated out. And you're hyper concentrating that around your implant and your bone graft. And then two, he hit all the clinical from a profitability perspective. If you're an insurance-based practice, you can add an extra $100 per site to the work you're doing and offset some of the reduction in fees you're getting. You're helping the patient out. You're getting better at phlebotomy and blood draws for when you incorporate IV sedation into your practice. So that way you have good reps on the veins when you're doing IV. So, and the cost to entry is very low. Like to start placing implants in your practice, you got to have a pretty good upfront expense. You get a $400 centrifuge, you get a, $50 box, and you get some phlebotomy supplies, and you're off to the races. And you have this first set of this skill set available to you. So it's a no-brainer. Everyone who's listening, try out the PRF. It will move the needle for your practice in a major way.
Yeah, I love it. Dr. Briskie.
The biggest, so increased success rates, right, for me, and then decreased costs. So I'm not using collagen membranes anymore or less frequently, right? Mm-hmm. So just regular, always just way cheaper all around, which I love, and things heal way faster. And I think all of our students who come to our courses have seen that as well. I think a lot of them are very surprised when we're doing full arch that we're not placing membranes down over the ridge. We're actually just placing PRF over all of our multi-units or healing abutments or anything. It's a huge cost savings.
Yeah. And when we do full arch, I'll do 8 tubes in the beginning, and then we'll spin it down, and then we'll do another draw for 8 more tubes later down the road. So that way you can do your upper and lower and have 8 slugs per arch as well. So that way you don't have it just sitting and drying out, or, you have blood sitting on the side and you can't spin it, because you got to get this thing in the centrifuge ASAP.
Awesome. Well, gentlemen, we will do an entire episode just on membranes, but that was a great introduction because they're you're integrating PRF with membranes, so that'll be kind of part 2 of this discussion on the next Surgical Saturday. But as far as things coming up for CSI, the September course is completely sold out. That is for single implants and wisdom teeth. But in November, our next course still has a few seats available. We're going to be doing single implants, wisdom teeth, and full arch. Is that correct, Dr. Dhoon?
Yeah, one of the cool things about the new facility is we have 2 conference rooms now that can hold different groups being taught at the same time. And we have so many operatories upstairs that we can run concurrent courses. So if you come for singles or wisdom teeth, we got you covered. If you come for the full arch, we got you covered. And we'll also be potentially running a few IV docs through it. So if you're interested in really any of the above, reach out to us. It's going to be our last course for the year. And then we go enjoy the holidays and we come back. And we have our 2024 calendar already released as well.
Yeah. And tying it back into this lecture, you most definitely, if you're interested, we'll have the opportunity to draw blood, and we'll show you the complete, workflow for creating those PRF booger slugs that Dr. Briskie was talking about. And we'll show you how to integrate them into your bone and into your membrane for more rapid healing for full arch if you want, or into single implants and wisdom teeth as well. So I think that it's a great extra added bonus just for being there. You will get plenty of opportunity if you choose to do so to draw blood on the patients and your fellow attendees if they're willing. So so that's it, guys. Thank you guys so much for being here. I can see you're both getting ready to go back into surgery. It's always great to catch up with you. We're doing these Surgical Saturdays once a week now, guys. So every Saturday you can look forward to hearing these really advanced surgery techniques and philosophies. So we will talk to you guys next time.
Cool. Thanks, Mark.
Awesome. Thank you, man.
being a successful dentist practice owner super stressful? What is a word stronger than yes? DentistJobConnect.com is committed to being part of the solution to one of the biggest problems facing the profession. Number one, finding awesome associate dentists, and number two, hiring amazing associate dentists for your team. Whether you are a solo GP looking to hire your first associate or have 27 practices with 87 associates, Dentist Job Connect can help. For being a loyal listener of the Dentalpreneur podcast, you get a great deal on DentistJobConnect.com. Just visit DentistJobConnect.com and choose from one of their amazing and affordable options to help you hire an associate dentist. Use the code BICEPS10 to save 10%. Oh yeah, and everything I've learned about bicep curls, I've learned from my great friend and the founder of Dentist Job Connect, Dr. Paul Goodman. And that wraps it up for another episode of the Dentalpreneur podcast. Look forward to reconnecting on the next episode.
Thank you so much for joining us today on the Dentalpreneur podcast. Check out TrueDentalSuccess.com for full recaps of every show, a schedule of our live events, free video tutorials, and a whole host of practice building resources.